Welcome everyone to this podcast. The focus of the podcast is the focus question: what role do healthcare facilities and services play in achieving better health for all Australians? In this podcast, we'll be focusing on the students learn about healthcare in Australia with a sharp focus on the responsibility for health facilities and services. The healthcare system involves a complex interrelationship between Commonwealth, state and local governments, as well as health insurance funds, public and private providers of services, which include doctors, dentists and physiotherapists, etc., and individuals and institutions such as public and private hospitals and nursing homes, as well as other non-government organisations, for example, community health services, self-help groups, and community support groups. Planning for health means the reduction of inequities in health, so priority must be given to the disadvantaged population groups, the sharing of health benefits among all rather than a greater number of benefits for a few, the importance of quality for all in a normal lifespan rather than trying to extend life beyond a normal lifespan, and giving great priority to large benefits rather than lots of small ones, with saving lives being the most important. In the past decade, there have been 4 significant events that have had an impact on the provision of healthcare in Australia. These have included increases in chronic health conditions, changes in how services are used, increased use of technology, and improvements in productivity and efficiency in healthcare service delivery. Traditionally, the healthcare system has provided diagnosis, treatment, rehabilitation, and care for people with illness or injury. Healthcare has been dominated by the medical profession. They diagnose and treat patients, control access to the medical profession by influencing course content and available university places, and influence the allocation of funds for research. This has meant that they have a lot of say in the registration of doctors and the services they offer, and they can deny doctors the right to practice by stopping them from registering or obtaining Medicare coverage. However, there has been a growing recognition of alternative therapies and their place in healthcare, and this demand has meant that doctors will refer their patients. This will be covered in the podcast on complementary and alternative healthcare approaches. Healthcare is provided for by both public and private institutions. The government, through Medicare, provides payments to doctors and services. Private health insurance companies also finance these services and provide people with extra coverage for non-essential services and alternative medicine. Non-government organisations such as Maine and Ramsay Health provide private hospital care, pathology services and other medical services for a fee. Some non-government organisations are not-for-profit and provide services for nominal fees. The Royal Flying Doctor Service and the Cancer Council are 2 such examples. The Ottawa Charter for Health Promotion has stated that the importance of reorientating health services. Health practitioners are today more conscious of their role in health education, promotion, community empowerment, advocacy and public health policy. The media has assisted in this, as has the emphasis on health promotion and prevention. The Australian Government provides most of the funding for recurrent expenditure. Recurrent expenditure refers to spending on day-to-day services. This funding for recurrent expenditure includes expenditure on services provided by general practitioners and medical specialists, together known as medical services, and to a lesser extent on services provided by other health practitioners. The Australian Government provides funding for medical services through Medicare, private health insurance subsidies and benefits for veterans. It also provides funding for other health practitioners. Pharmaceuticals are covered partly or fully by the Pharmaceutical Benefits Scheme, or the PBS, or the Repatriation Pharmaceutical Benefits Scheme, the RPBS. Most of the funding for these pharmaceuticals was contributed by the Australian Government. And finally, the government supports and provides funding for health research. The government also provides expenditure on the health workforce and also partly funds public hospital services and public health activities such as infectious disease control and health promotion campaigns through direct funding and through specific purpose payments to states and territories. The main health-specific purpose payments have been made to the Australian Healthcare Agreements and the Public Health Outcomes Funding Agreements. These are the provision of highly specialised drugs to outpatients in public and private hospitals. And finally, the Australian Government also partly funds private hospitals through subsidising private health insurance premium. This subsidy amounts to almost a third of the gross funding that is provided through private health insurance funds. The Australian Government funds hospital services, both public and private. The main funding sources for these services were the state and territory governments that contributed almost 50% of the total hospital funding, and the Australian Government, which provided almost a third of that funding. Non-government sources provided an additional 20.7% of the funding. Primary healthcare services also receive funding from the federal government, but they receive slightly less than the federal government gives to hospital services. The Australian Government was the primary fund provider for primary care, followed by the non-government sector and the state and territory governments. Additional funding is also provided for other recurrent components of health system and for health infrastructure. Infrastructure refers to buildings, and this is also referred to as capital expenditure. The main source of funding for other recurrent healthcare goods and services was the Australian Government, who provided almost 2/3 of the recurrent health funding, while the non-government provided a third of that, and the states and territories provided the final 11.3%. The state and territory governments provided close to 2/3 of the funding for capital expenditure. State and territory governments. State and territory governments provide funding for community health services, patient transport, in other words ambulances, public hospital services, and public health activities. Local government has an important regulatory role in health protection, set out in legislation such as the Public Health Act of 1991 and regulations and the Food Act of 2003. In addition to activities of local government such as land use planning that have indirect impact on public health, there are a range of direct roles performed by staff such as environmental health officers in areas such as food safety, potable or drinking and recreational water safety, preventing the spread of Legionella through microbial control, preventing the spread of blood-borne disease through monitoring of skin penetration premises and sharps disposal, preventing the spread of diseases such as Ross River fever, and tobacco control activities. Local councils also have a history of providing childhood immunisation services. They also have a role in promoting health through urban planning that facilitates increased physical activity, access to affordable healthy food, less reliance on the private motor vehicle and thus improved air quality and reduced injury, attention to the provision of shade and staff sun protection, and consideration of how to reduce injury in urban environments through appropriate design. These goals are not only promoted through good urban planning but effective social planning. Policy development and community service provision. Local government also has a direct role in provision of a range of community services that impact on health and or target vulnerable groups such as Meals on Wheels and home and community care services, recreation and youth centres and childcare services. Local government staff who have an impact in these areas include urban planners and designers, social planners, recreation officers, road safety officers, community safety officers, community development and community service staff, including children's services staff and youth officers, and staff working specifically in the area of health promotion. Examples of local government initiatives include tobacco, alcohol and other drugs, for example WH&S policies, prohibition of smoking in council facilities or eateries around halls, pools, playgrounds and sports grounds, preventing cigarette sales to minors, alcohol-free zone, alcohol use around council premises, binge and underage drinking and other drug and alcohol harm minimisation. Sun protection through WH&S strategies and shade provision in public places, Sun Smart for childcare centres and shade provision for outdoor pools. Miscellaneous health such as a reduction in aircraft noise, contaminated land, asbestos disposal, backyard burning, etc. Food safety, such as that required to set up temporary food stalls and mobile vending, food premises construction and fit out. Community safety and crime prevention, for example, road safety plans, community safety plans and crime prevention plans. On-site sewer management, communicable disease prevention, such as HIV/AIDS or other bloodborne communicable diseases policy, infectious disease, and obviously childhood immunisation. WHS and child health. Child health including playground safety, immunisation and baby health, and other miscellaneous health promotions such as gambling action plans and active participation in physical activity. Non-government sources or non-government organisations. Non-government recurrent health expenditure funding comes from various groups such as the Cancer Council, the Heart Foundation, etc. These include funding for out-of-pocket expenses by individuals, benefits paid and funded by private health insurance, provide compulsory motor vehicle third-party insurance and workers' compensation insurance, and also other private sources of income. Non-government sources provide funding for aids and appliances, things such as artificial limbs, for example, or walking frames, dental services, private hospitals, and medications. And now it's over to you. Your job now is to consider how best to evaluate the care provided in Australia to the various groups that we have been studying. In order to evaluate this, you'll need to investigate issues of access and adequacy in relation to the social justice principles: participation, equity, access, and rights. The syllabus also has some additional questions for you to consider, such as how equitable is the access and support for all sections of the community, and how much responsibility should the community assume for individual health problems. Thank you for listening to this podcast.